Hey YouTube, it is Shalise. I was coming to give you guys an update on my thyroid biopsy. I went in this morning. If you look right here, you can see where they poked me at right there. And overall, it was a little uncomfortable. The first shot I think was supposed to numb me, and it stung a little bit. Then he did 4 biopsy needles. When he stuck the first one in, I flinched and he was like, "You can feel that?" And I said, "Yeah." So then he gave me another shot of numbner. The first one, though, as far as the biopsy needles, the first one didn't hurt. The the rest of them, the last 3, hurt. And they hurt because it was almost like he was in there moving around trying to get the tissue or whatever it was. I don't know if it was tissue or fluid he was necessarily trying to get, but whatever it was he was trying to get, he was having to like apply pressure and move around to get what he needed. So those last 3 hurt. And obviously, because they've been poking at my thyroid, it hurts really bad now. So that is what is going on as of right now. They sent it off to the lab. It takes about 5 days. My appointment for my results is on October 24th at like 4 something in the afternoon, I believe. I've been doing my research because as a singer, you know, somebody gets cut on your throat, you can lose your voice. And especially with thyroid surgeries, typically when people have surgery and they sing, they can't sing after them. So I started YouTubing to see about people's procedures and see what you can do if you're a singer. And I found a doctor in Baltimore, Maryland at Johns Hopkins. His name is Ralph. Where's my purse? Because I wrote it down. His name is Dr. Ralph. Let me get his last name for you. His name is Dr. Ralph Tufano. That's why I couldn't remember. It was something a little different. And basically, if you're having your thyroid removed and you sing, you want to ask somebody, do they know how to basically isolate or protect the external laryngeal nerve? That is the nerve that's for singers in your voice that deals with your range and your ability to be able to sing. So, I am going to ask the doctors here locally if they know how to do a procedure and protect that nerve. And if they say no, I did check. Now, I did not have them run my policy, but they do accept my insurance provider at the doctor in Baltimore. So I would have to fly up there and stay up there for a week. I called and talked to, see, I'm on it. I called and I talked to, I was at the office coordinator or something like that. And she was real nice and helpful. And so basically she said because I'm in Kansas that I would have to either fax or email over my records and he would review them. And if I need any more tests done, he would tell us what all other tests I need to have done and I can get everything done here. And then basically I'd go up there to physically see him and do an exam. And if he thought of any more tests, then we would do them at that time. And then they would do my procedure within the week of me being there, since it would be a plane ticket and hotel stay for me to go and have that done. Some people might think this is extreme. As somebody who's been singing all their life, I don't want to lose my voice. Not, and I know that might sound vain, but I don't. And I feel like if there's an option for me to not lose my voice, and if my insurance is still going to cover the procedure, I will gladly pay for plane tickets and a hotel stay to keep my voice. I don't want to lose it. For me, music is therapeutic, and I sing a lot whenever I have issues or stress is going on, or sometimes I sing at church or funerals or whatever, and so I don't want to lose my voice. Now, granted, I'm not a professional singer. I ain't. But that don't mean that because I'm not a professional singer that my voice is invaluable and that my voice doesn't have a value, at least to myself. So with that being said, anything I can do to protect my voice and to not lose it, I'm going to do it. I don't know what I would do if I couldn't sing. I really don't. I think I'd be really depressed, not gonna lie, because when I tell you, whenever I'm stressed out or stuff is going on, I literally sing, and that is just kind of how I get through stuff. So for me, I need my voice to work. So yeah, so we're just gonna fingers crossed. And my mom, of course, is like, well, you mean tell me can't nobody here do what that man do? Considering the fact that he developed a tool that protects your vocal cords in 2014, I highly doubt it at this moment. But I am going to ask, and I'm not going to lie. If they sound like they even got a glimmer of doubt, no go. I already don't like the fact that I had to call the doctor to ask them for my results from the thyroid sonogram. And then they said, oh, we'll have somebody call you back. And then they had the doctor actually go look at it. So you mean to tell me my results was sitting here for a week and you didn't look at that? So I'm already not really liking the patient care that I'm getting from this doctor's office. I'm not going to lie. But at this point, I just need to go through the steps so that I can do what I need to do for my health. So, yeah, that is what I'm going to do. I will say when the doctor pulled out the sample for the biopsy, he said that it looked questionable. I think because he's been doing them for so long, he can probably tell if it's benign or if it's cancerous. And he was just like, yours is kind of in the middle. Like, it don't look good, but it don't necessarily look bad either. But he was like, so yeah, yours definitely is something that I would highly recommend, being tested, because I can't look at it and tell. He was like, but typically he can look at the sample and tell if it's benign or if it's cancerous. Mine looked a little murky somewhere in the middle, so he couldn't 100% tell. So we're just going to see what they say. Not gonna lie, I did Google thyroid cancer symptoms, and I had like almost all of the symptoms except for maybe like one or two. Not gonna lie. That was the whole reason why I went to the doctor, was because I was having issues with my voice, like literally going hoarse and just having a sore throat, and I thought that it was my tonsils, and that's when they said, no, it's your thyroid. So just being honest, I'm not really terrified or worried about it. I'm just trying at this point to protect my vocal cords if I can. I know it sounds vain, but I'm trying to protect my vocal cords if I can. Because also, when I looked it up, like the survival rate is like 97%. So I figure I'm all right. I just gotta figure out, what all's going on after the biopsy and kind of get the ball rolling on this procedure, whether it'll be done here locally or if I'll be flying out to Baltimore to get it done. But other than that, that's it. Gotta do a little bit of saving because I'm gonna be off work for a couple of weeks, and I don't think I'll be able to get short-term disability for that in my job. The payout for stuff like that really sucks. I think anything after 2 weeks, they'll pay you like 60% of your pay. So I'm supposed to just pay 60% of my bills, but but I honestly think that the recovery time is like 2 weeks, and I figure if I'm up there for a week, I'm only gonna need one more week by the time I get back. So I'll just have to burn my sick time, my floaters, and then just save up enough to cover a few days of me being off work and just make it work. That's all you can do is make it work. So that is my plan. I will definitely need help from my sister and my mother with my kid because I am a single parent, so I will need some assistance with that. Just somebody to keep him while I'm out of town and doing this process. I will probably end up going alone. It's okay. I'm not terrified by that. You just got to do what you got to do. I understand people are busy and people have stuff going on, and right now I need somebody to care for my kid more than I need somebody to go up there with me. I can give them my mama's number and they can call my mama if something is going on. They call her and my sister and they can make decisions. I'll be fine. I don't know. I guess for me, I'm not looking at it as if it's like some really big deal because it happens all the time, and especially with women in people are perfectly fine. So I think in my head, I don't look at, I mean, yeah, it's an inconvenience and it's something that's a little scary when somebody is talking about throwing around the cancer word, but because of the percentage rate of it being treatable, and I don't look at it as being that big of a deal. It's just more of getting it diagnosed, figuring out your treatment, and just doing it. So that is my my goal at this moment, is just to get everything diagnosed, figured out, and let's just kind of get this ball rolling. My voice sounds a little raspy right now. You hear that? It's just going in and out, but that's probably too because, and you can really, if you look, you can see how big this side is versus this side. I never noticed that before. And the doctor asked me, she was like, well, did you ever like wear scarves to cover up your throat? And I'm like, huh? I promise you, I didn't notice none of this stuff until they told me something was wrong. I never. So pay attention to yourself. Look at yourself in the mirror. Look at your neck. Like, if you're looking, you can see clearly this side is bigger than this side. But yeah. So that is my update. It's getting a little lengthy, so I'm going to go ahead and shut up. I will give you guys an update on the 24th as far as what they say about the biopsy and what the next steps are. And I will also let you all know if the doctor here locally is able to do it, or if she knows somebody that's able to do it. Because, you know, sometimes doctors won't try to refer you to somebody else because they want to get the money. And they're going to learn real quick. I really don't care who get a check. I just want it done what's best for me. It ain't about your wallet. So, with that being said, thank you guys so much for watching. I will do my best to keep you guys informed on what's going on with this right thyroid gland. And then I also wonder too, last little tidbit, are they just going to take out the right side, or are they going to take out the whole thing? Because in my thought process, if you already got to go in there, I'd really just do a clean swipe. And I'm saying that just because I don't want to get cut on twice. If you're already right there and you're already in the area, just go ahead, do a clean swipe, make sure everything is done right, and just give me the thyroid replacement pill, and we call it a day. So anyway, that is my update. I will see you guys probably on the 24th of October, which is in about a week and a couple of days, I believe. Yeah, I think that's next Wednesday. So I'll do an update probably next Wednesday, maybe Thursday, but I'm going to do my best to do it on the day of the appointment. Thank you guys again, and I will keep you updated. Bye.